I'm doing the physician and nurse.
I'm Marina and I'm doing the physiotherapist and social worker.
I'm Dave. I'm doing the pharmacist and the dietitian.
Perfect. Okay, let's get started on our report. So, hi everyone. Is it okay if we all do our report now? Yes?
Sure.
Okay,
Yes.
Yeah.
perfect. Hi, patient X. I'm here. I'm your physician. I'm Dr. Elaine, and here's everyone else involved in your care. Is it okay if we do a quick update and status around your care? So, we have our nurse here, our pharmacist, dietitian, physiotherapist, and also social worker here for your report. So, you were admitted here because you weren't feeling too well and had a fever and tiredness, along with shortness of breath. Is that correct? Alongside that, during your stay, we found out that you had sepsis that originated from your PICC line. So we initiated antibiotics for that and removed your PICC line due to the infection. Since then, you have been improving and your sepsis is now resolved. Do you have any questions? No? I will let your nurse give their update now. Hi, patient X. I'm Nurse Elaine and I will be in your care team for today. The patient's goals for today is to sit up at the edge of the bed and increase her mobility. Is that correct? Overnight, she had a calm and uneventful day. Current vitals are blood pressure of 130 over 78, heart rate of 77, temperature of 36.8, resp of 16, and SpO2 was 98 on room air. Pain has been managed through sub-Q Dilaudid every 4 hours. The patient has been eating less than 50% of her meals due to her nausea. Fluid intake is normal, adequate urine output as well, but she has not had a BM in 3 days. The patient is alert and oriented. Um, the patient also needs support using a bedpan and washing due to her mobility. Um, and her mobility has decreased due to her pain. There was a Foley that was inserted 4 days ago and it's draining well. Another PICC line was inserted for IV antibiotics and it was inserted on July 2nd. The patient is currently on enoxaparin for VTE prophylaxis and was decreased due to her weight loss. She has one sub-Q line for hydromorphone. Blood checks aren't needed. And I was just wondering if there were any PRNs for her nausea, since she does have a bit of nausea. Um, Maybe switching over to ondansetron might help her as well. But other than that, are there any concerns that you have for me, patient? No? Okay.
Hi, I'm your pharmacist. From the medication standpoint, the patient is not diabetic, so no glucose management concerns at this time. For pain management, you are receiving scheduled subcutaneous hydromorphone every few hours. This just means it's just going in under the skin. Pain appears to be managed with this regimen, but we will continue to assess the effectiveness and any signs of excess sedation or any adverse effects throughout your hospital stay. Regarding anticoagulation therapy, the patient has previously on enoxaparin twice a day, but due to the recent weight loss, we will adjust the dose or the timing just a bit. Instead of getting twice daily, you'd be now getting once daily starting today. For antimicrobial therapy, this is your antibiotic therapy. The patient's receiving clozaxilin, which is planned to be completed on August 27th. This will take about a 6 week course. The organism is quite sensitive to this, so I believe it is an appropriate therapy we could start. We can reassess closer to completion, but as of now, we'll discuss that further down the line. As of now, there's no high alert cardiovascular or respiratory conditions that are present, and no antiplatelet therapy concerns at this time. Uh, no additional PRN medication recommendations at this time for me, but we will still continue to use the standing ward orders for nausea management. I will also add for gravel or ondansetron if it's not on the standing ward orders yet. In terms of vaccination, the patient is pretty much cut up to date and received her pneumovax in 2016. Dietitian. Hi, I'm the dietitian. Looking at the recent nutritional status, the patient is currently on a regular diet with a soft texture just because of her dentures. As of now, there's no fluid restrictions that are in place. In terms of intake, the patient has been consuming less than 50% of oral meals during her hospital stay, so she's not meeting the nutritional requirements she needs. This would be also further impacted just because of the nausea that's been going on and not being able to keep that food down. Looking at the our parameters, the patient weighed yesterday. They have lost 6 or 7 kilograms since admission, which is quite significant, and it does raise a concern about eating habits while during your stay. This will impact things like skin integrity or decrease wound healing if it's not really addressed. So, going forward, today's plan we will continue with that nutritional supplement. This would be your Ensure, the one you've been receiving this morning for breakfast, with just the meals for lunch and supper as well, and focus on strategies to improve intake, including just to manage that nausea, having small and frequent meals here and there. We also want to consider about adjusting your food preferences or texture if needed. You can let your nurse know, and we'll be happy to change your food preferences whenever you prefer. The patient will likely need some guidance maintaining adequate intake at home and continuous supplements if the oral intake remains poor. Okay.
Okay. Hi, I'm the physiotherapist working with you. I've been involved in your care since early July when you were first admitted. Before coming into the hospital, you were able to walk independently at home, but since then, your mobility has been quite limited. You made some progress through. You have gone from needing a full lift, and now you're able to use a sliding board with the help of one or two people, which is a really positive step. I understand you also been having some right knee pain, and we are still waiting on updating on weight bearing instructions after the MRI showed a new area of infection. For today, I will plan to see you and continue working on your mobility and strength. Because your progress has been slow, you will likely need to take some time in rehab or convalescent unit before going home safely. How that sounds to you? Hi, I'm the social worker on the team, and I just want to talk a bit about your situation at home and planning for discharge. I understand that before coming into hospital, you were living with your mom and didn't have any home care supports in place. Right now, we're still figuring out what supports you might need when you leave the hospital. Based on your current immobility, it's likely that you will need some time in convalescent or rehab until before going home. The current target discharge date is August 30th, but that can change depending on how things go. I will continue working with you and the team to figure out the best plan and make sure you have all the supports you needed. Does that plan make sense, or is there anything else you're concerned about?
Okay, perfect. So I do have a few updates left to give you. I know you brought up a concern about your knee, so we ended up doing an MRI. Like physio said, the MRI did show a new infection in your knee that might have spread from your PIC line or some other mode of transmission. But we have consulted orthopedics and the infectious disease team as well, and they will follow up with you soon. We don't have any updates from them right now, but um, we will update you as soon as possible. Other than your knee, I know your nausea has been a really big issue, so we'll probably get you started on a stronger anti-nausea medication as well. I did read in your chart you did have some chronic pain. I was just wondering what medications have you been taking at home for that chronic pain, and if they have been working well. I know you're on hydromorphone right now. Um, I just want to see what we can give you upon discharge if your chronic pain meds don't have not been working. Um, But do you have any questions for us at all? No? Okay, perfect. Thank you so much.